We all saw in the news in the last few days, there's been a rash of overdose deaths in our state. These appear to be primarily related to very high potency synthetic opioids that are made in a laboratory, not derived from plants. These opioids are tens of thousands of times more potent than your standard morphines or oxycodone like in Percocet. These drugs cause overdose deaths very rapidly after use of just a single dose. They are incredibly hard to reverse with the opioid antagonist Narcan, and it's going to be a real issue ongoing for our citizens of our state. Because these medications, these drugs are incredibly potent, they do not respond to the usual doses of Narcan like your garden variety oxycodone or heroin overdose. Usually 1 or 2 doses of Narcan will reverse a prescription opioid or heroin overdose. These potent synthetics may require 20 to 30 times that amount. Most first responders, including our law enforcement officials, fire and rescue teams, do not have anywhere near adequate supplies to reverse even a single patient, much less multiple patients. The other issue is that these drugs can be absorbed through the skin and easily aerosolized into the air, breathed in by the first responders, including law enforcement and paramedic teams, and they can actually succumb to the effects just by being exposed to them. We certainly need more education and prevention. It is much easier to prevent these problems than to try to react and treat them. I applaud the legislature and Governor Deal in recently passing our Narcan laws that allow Narcan to be available over the counter to anyone in the state of Georgia that wants it. However, I would like to see us continue to improve that law and have anyone who requires Narcan to be resuscitated to be required to have a evaluation for a substance use disorder and offered treatment if it was indicated. I think the most important thing for all of our citizens to remember is that this is not something that these people are necessarily doing to themselves. Certainly their first use of drugs is usually volitional, but once they have used these drugs several times, they are going to start to develop addiction. And once they become addicted, it's no longer about being weak-willed, morally bankrupt, crazy, dumb, or stupid. It's about having their brains hijacked, and this is a disease that needs to be treated.